Today we're going to talk about a concept of safety and quality. We always talk about quality work, and of course I'm very, very dedicated to do quality work. That's my real impetus, is to make sure that I deliver the best that I can humanly do for you. But sometimes before we can engage in a discussion of quality, we have to engage in a discussion of safety. What does that mean? Well, it always means to err on the side of being conservative. And let me give you some examples that I think are illustrative. And I think a lot of it has to do with treating very, very young patients. But again, it comes to my mind because before I did this video, I was thinking, what could I explain to you? And these three ideas came to my mind that I'm going to explain to you. But again, it really involves almost everything. And in fact, almost a day doesn't go by without my saying safety before quality, and to the point where I go, I got to shoot a video on this. And that's usually when I think about the idea. So let's use a couple examples. I had a 27-year-old gentleman come in with, he was losing hair, and he said he wanted to have a hair restoration. So, at that point, 27 is usually quite young. I usually don't do a hair transplant someone that young, but he had very thick donor hair, and I wanted to do a very conservative hairline. And the reason is he's going to continue to lose hair as he gets older, and we're going to run out of donor hair. It's not going to match. He's going to need too many transplant sessions, and eventually his result could be unnatural given his very, very young age of doing it. I usually like to wait at least into the 30s if at all humanly possible, but that's not always the case. It depends on a lot of situations. But the point is, with this gentleman, he wanted a hairline like his friends in their 20s, really low and super straight to the point where it was far below where his existing hairline was. And I realized that that would have been a significant problem because patterns would develop that would look unnatural within 10 years. And he said to me these words, "I don't care what I look like at 40. And I said, "I'm 40 and you will when you get there." And it's my responsibility not to rush in there and do his procedure for him just because he wanted it. He was really to put the money down that day. And I said, no. And the reason for it is not the fact that I can't do a quality hairline. It's because I can't do a safe hairline in the next 10 years. Another example, I had a 21-year-old lady on the forum asked me a question. She is an athletic individual, and she was paying a lot of money for having fillers, ongoing fillers. And she said, what could she do to correct this problem more permanently? And so she was going through some options of maybe fat transfer, for example. She knows I do that. And I felt 21's a pretty young age to do a fat transfer. And the reason is similar to a hair transplant. I don't know how that's going to age on you, given that very, very young age. I tend to like to do it in someone's 30s at the earliest, maybe mid-30s and beyond, although I've done a couple late 20s and a very, very select case and very, very little bit of fat in there. But that's something that's a judgment call. And I felt that a cheek implant, being a bony structure in an area that's volumetrically depressed with soft tissue, would also not be a good option. And then, like I do some silicone microdroplets, which we're going to talk about in a moment. I also felt that was unsafe because I'm not here to rebuild a whole young face that's thin, that as she gets older, it could be too big. So, is the only option temporary products? Well, she was asking me some questions about using some permanent fillers, and I didn't really feel comfortable talking about some of the products who are not FDA approved, and other products at the same time, yeah, I don't feel comfortable even injecting something that's permanent FDA approved in someone that young because I don't know how that's going to age on that person. So even though it's expensive, sometimes the most expensive option is the safest option, and that's something that we need to keep in mind. So I'm not going to dwell too much more on it. I'll just mention one more thing. You may have seen my age-appropriate lips and the fact that if I'm working with silicone lips, I tend not to work with a lot of early to mid 20-year-olds with permanent enhancement because I don't know how that lip is going to age. Now, obviously, I can do a lot. I do a ton of corrective lip work. I did 5 that a lot of whom had flown in to Dallas for my work last week, and it was not due to aging of the lip. It was just due to bad injectables or other reasons. And so, in that circumstance, I just want to sort of frame that idea is that I really remember when I say safety before quality, if you've seen this video, it's going to hit your mind and go, yeah, it did sort of trigger a thought impulse of really understanding why. So I have to go through that large background story. So hopefully that was a good video for you.